too. Now let's talk about some important research on dementia that's come out. A third of dementia cases, we're told, could be prevented if people looked after their brain. A study, it's come out in the Lancet Medical Journal, has come up with 9 risk factors for dementia. Some of them relate to physical health, like diabetes. Physical inactivity can cause a problem. There's also the level of education and social isolation as factors. We're told as well that 47 million people in the world are affected by dementia now, but look what's going to happen over the next few years. Around 131 million people could be affected by 2050, and the proportion of sufferers in low and middle income countries is predicted to go up. I've been talking to Dr. Howard Fillit. He's from the Alzheimer's Drug Discovery Foundation. He tells me here what he's seeing as being new in this report.
Okay, well, this is a report by the Lancet Commission, and it's actually a very important report which summarizes the body of evidence on multiple aspects of dementia research and care, and probably one of the most important things is about dementia prevention, which has been an accumulating field in our space over the last 10 or 15 years, accumulating research. And the report goes at it with the Commission in a very systematic way to tell us about what are the risk factors throughout life for Alzheimer's disease and related dementias. Such things as early childhood education, midlife risk factors such as hypertension and obesity, and late life risk factors like diabetes and exercise, which is actually throughout life, smoking, and other risk factors. And they rank them to give us a kind of a score and tell us which risk factors might have the most important impact on being able to prevent dementia. And the Commission also summarizes some of the data on the strength of its evidence in terms of how likely is it that we really can prevent dementia in late life. And they conclude that about 35% of all dementia cases could be prevented with proper interventions and treatments along the lines of the kinds of things we just discussed.
And so is it your hope that this study may influence how governments spend their money?
Yeah, because, you know, although there's been a tremendous amount of research on prevention of dementia, it hasn't really been institutionalized and accepted by national bodies, for example, as and then be able to have the strength of evidence indicate public health messages for people, for example. There was recently a study published in a major medical journal that actually concluded that the risk and the rate of dementia is actually going down. Even though the number of cases is going up because our population is aging, the actual rate of it at a particular age is going down. And this has been associated with improvements in education and probably lifestyle over the last 30 years or so. So there's actually evidence that dementia prevention can be an achievable goal.
And there are going to be people watching this interview all over the world thinking, okay, what are the most important things for me to do to try and avoid having dementia in later life? What would you say to them?
Well, I think that if they're in midlife, which is actually the time that Alzheimer's disease starts, that the most important thing is to not be sedentary, to have lifelong exercise. Don't be alone. Remain occupationally and socially engaged throughout life. Consider lifelong learning. Build your brain throughout life, because this builds what we call cognitive reserve. And when people have cognitive reserve, they are better able to be resilient against the forages of old age, brain diseases like Alzheimer's disease and vascular dementia. If you have hypertension and diabetes, make sure that you treat those medical comorbidities, because they are also risk factors, and there are effective drugs. And some drugs actually are better than others. For example, there's evidence that some antihypertensives have neuroprotective effects, and our foundation is conducting studies of these specific antihypertensives that have neuroprotective effects, and also studies of diabetic agents that might have neuroprotective effects. And I think that's kind of the future of how we're going to use treatments for these medical comorbidities to prevent dementia in the future. But take care of yourself, lead a heart-healthy lifestyle, and in late life, or obviously throughout life, don't smoke, avoid obesity, eat a Mediterranean diet, and live a healthy lifestyle. Those are the most important things that people can do. We typically think of those things as protecting our heart, but actually they're just as effective in protecting our brain.
Fascinating. Thanks, Dr. Howard Fillit.